Hello, I'm Lotte. I'm a junior doctor in the East Midlands, and this presentation will be an overview of robotic surgery. Robotic surgery is a type of endoscopic surgery and can be used in a wide range of surgical specialties, such as gynecology, urology, and cardiothoracics. Robotic surgery can overcome some of the problems associated with minimal access surgery, or keyhole surgery, but disadvantages still remain. There are numerous benefits of minimal access surgery over traditional open procedures. Small incisions reduce scar burden as well as the rate of complications. Patients who undergo minimal access procedures recover quicker, leading to shorter hospital stays and reduced financial costs. As mentioned, minimal access surgery comes with disadvantages. These include loss of depth perception due to 2D images and loss of natural coordination. Intuitive movement becomes more complex and dexterity is reduced. Robotic surgery was first described in 1985 and was first used in hip replacement surgery in 1992. In 1994, robots were used to move endoscopic cameras by either foot pedals or voice commands. The Da Vinci robot was first developed in 1997 and are the robots commonly found in theatres today. Currently, the robotic suite consists of 1 or 2 surgeon consoles, a patient-side robotic cart, and vision tower. Instruments are located onto the robotic cart and plugged into the vision tower to provide video feed and input for things like bipolar instruments. These instruments are controlled directly by the surgeon consoles. The surgeon console is made up of a number of foot pedals, a touchscreen, buttons, and 2 hand controls. The hand controls directly determine the movement of the various instruments and overcome many of the disadvantages of minimal access surgery. In endoscopic surgery, there is usually 1 camera lens at the end of the scope. However, in robotic surgery, there are 2. The headset within the surgeon console displays each camera image onto a separate screen for each of the surgeon's eyes. This allows for 3D vision and much better depth perception than with 2D vision. The hand controls in the Da Vinci console allow a surgeon to use the instruments in a way that feels much more natural than endoscopic surgery. Using the fingers in a pincer movement replicates the actions surgeons would normally use in open surgery, rather than the levers and triggers found on the ends of endoscopic instruments. The robot can also smooth the surgeon's movements, reducing the impact of any light tremors. Here's a video that demonstrates how a surgeon's hand movement translates to the robot arm movements. Robotic instruments have greater dexterity than endoscopic instruments. Endoscopic instruments have 6 degrees of freedom, while robotic instruments have 8, which allows it to move in a similar way to the human hand. Here's some videos to show what the Da Vinci robot can do. However, robotic surgery is not without its disadvantages. The kit is time-consuming to set up and drape. Training and equipment is expensive, and there are strict safety procedures to adhere to. Anaesthetists can find it difficult to manage their patient due to bulky kit overhead. The theatres must be large enough to accommodate not just the robot, but also the consoles and other equipment, as well as a normal theatre team. Many surgeons also struggle with the lack of tactile feedback when handling tissue. The future of robotic surgery looks bright. There are many developments underway, such as nanorobots, multiple arms on one instrument, and multiple cameras. There's also the option for teaching consoles, robotic assistants, and unmanned or long-distance surgical systems. In summary, there are many benefits of robotic surgery over endoscopic surgery. However, disadvantages still remain. As the field is constantly developing, there's huge scope for future projects within robotic surgery. Many thanks for your time.